Hi, welcome again to the section of cardiology. This is Dr. Jaitly. I'll be talking to you very briefly on the subject, which is a burning issue, whether or not secondhand smoking is as injurious to health as first-hand smoking. Secondhand smoking, SHS, is it as injurious? Well, all I can say is one death is too many if that occurs from secondhand smoking. The fact checks suggest that the thousands of fatal heart attacks, strokes, lung cancers occurring every year, year after year, from secondhand smoking. Now that says it all. Why? Because nicotine levels have been found in non-smokers who have been exposed to secondhand smoking either from their spouses, from their employee peers, or from their social networking where they are hanging out, or even in the children when the parents are smoking, or their guardians, or even their caretakers are smoking. So anybody who is in charge of the children, obviously, if he or she smokes, then the children will suffer. So it's very, very crucial for us to understand how the innocent children can get exposed even at homes from secondhand smoking. However, there is some good news though, that it is getting better, because that's the question I always ask. Now we know smoking affects heart attacks, like I've shown in the left side of this panel, where the coronary plaques can develop and they can accelerate if somebody is smoking, or if you already have some precursor, like say if somebody is hypertensive or diabetic and now is exposed to a secondhand smoking, the effects are pretty much immediate. And so it is very, very crucial that even if you have your windows down and you're driving in the car and you're smoking, the other persons who are sitting in the car who are not smoking are getting secondhand smoke exposure. So bringing down the windows doesn't help, or opening of the house opening of the house doors or opening up of the house windows does not help. So a smoke out means smoke out policy is a policy where somebody has to go out and smoke and cannot smoke within to expose to the people, whether it's in the car, whether it's in a theater, a public place, airport. I remember the years when actually you could have smoking sections and non-smoking sections on a plane flight. So those days have also gone by, and now even on long airplane flights from one continent to the other, it's a non-smoking flight. So I have no pity for the smokers, unfortunately, but the fact is that they have to, they cannot smoke because the air circulates within the plane. And that internal circulation of the air within the plane, or say at the airport, or even within the hallways of a hotel or restaurant, that air just recirculates back in, and the non-smokers can sustain a secondhand smoking injury. So it is so crucial for us to recognize, and I'm very, very appreciative that the US has made those regulations possible, where now you cannot smoke within any public place, including workplace, restaurants, theaters, and malls, etc., etc. So, and the incidence is also getting better from other reasons, where increased more awareness from within the households. Say if a person is a smoker, and I pity that he's not able to quit smoking habit, because it's a very, very tough habit to really quit. And so the household or the family has decided that the person can go out and smoke. So a smoke out policy from household to household is a very interesting increased voluntary mechanism that has also helped decline the overall incidence of secondhand smoking, if you will. And then a declining smoking incidence per se over the last 2 decades has been seen since 80s and 90s, and the millennium turn. People have cut down on smoking. There's more awareness about the injuries, and there's more awareness of secondhand smoking, etc., etc. So a lot of decline has happened. Now, on the right side of the panel, I've just shown a brief place where there is a plaque that can develop and that can accelerate from smoking, and as a result, that plaque can rupture or clot can migrate. It's called an emboli, and then migrate into small, very fine arteries in the brain, and that could lead to a stroke. So a heart attack, a stroke, a lung cancer, these are very, very documented cases of secondhand smoking, and there are thousands and thousands still occurring year after year after year. Okay. Thank you for your attention. Hope you gained some information out of this, and please go back and supplement more from the textbooks and medical journals. Goodbye.